If you clicked on this video and you're a doctor or an advanced practice clinician, chances are you have some concerns or even fears about the ketogenic diet. I get it. I've been there too. When I first heard about keto, I had the same doubts. After all, we weren't taught much about nutrition in medical school, and what we did learn often warned us against diets like this. But then I started to dig a little deeper. I pursued a master's degree in nutrition, studied the research, and what I discovered completely transformed how I practice medicine. Now I spend just as much time helping patients get off medicines as I do prescribing them, and I want the same for you. In this video, I'll break down 5 myths about the ketogenic diet that may have been holding you back from recommending it to your patients. My hope is that by the end of this, you'll feel more confident, more informed, and maybe even inspired to rethink how you approach nutrition in your practice. Let's get started and talk about the 5 keto diet myths. As you know, there are still so many misconceptions about ketogenic diets. Misconceptions that affect your 2,500 patients. Yes, that's right. Most doctors in the United States have at least 2,500 patients. If these myths keep you from recommending keto, it could mean patients will be on insulin longer, continue to struggle with obesity, or miss the chance to reverse chronic diseases. But don't worry, because today I'll debunk 5 of the most persistent myths about keto with a deep dive into the science that every doctor, advanced practice clinician, or any other type of clinician needs to know. Myth number 1, keto causes high cholesterol and heart disease. For decades, saturated fat and cholesterol have been wrongly demonized. Here's the truth. While LDL cholesterol might increase on a ketogenic diet for some patients, the key lies not in the quantity of the LDL particle, which we were taught in school to focus on, but the quality of the LDL particle and its size. Small, dense LDL particles are the ones associated with atherosclerosis, while large, fluffy LDL particles are less harmful. Keto increases the proportion of the less harmful larger particles, but there's more. On keto, triglycerides typically drop by 30 to 50%. While HDL, the good cholesterol, increases significantly, and a low triglyceride to HDL ratio is one of the best predictors of good metabolic health. And with that in mind, the goal is to have a ratio of less than 2, but even better is a ratio of less than 1. This is a much more effective way to predict cardiovascular risk than a total cholesterol or a total LDL cholesterol. Let's talk a little bit about the mechanism. A ketogenic diet lowers insulin levels, reducing the liver's production of triglyceride-rich, very low-density lipoprotein, VLDL. Lower insulin also promotes the breakdown of stored fat called lipolysis, reducing circulating triglycerides. So as a clinician or even a patient, consider shifting your focus from total LDL to better markers of inflammation and cardiovascular disease. For example, as previously mentioned, a triglyceride to HDL ratio with a goal of keeping it less than 2, a fasting insulin level with a goal of keeping it less than 10, or measuring inflammatory markers like C-reactive protein, sedimentation rates, and getting those measures in a normal range. LDL particle sizes with a goal of having less of the small LDL particles, apoprotein beta-A ratio with a goal of being in the lower risk range, and measuring the lipoprotein small particle A, which is a genetic marker of cardiovascular risk. And of course, a coronary artery calcium score, which most health systems are offering at affordable prices with a goal of a score as close to 0 as possible. And for my low-carb community members, share in the comments other markers of cardiovascular disease that you'd want doctors to know. I'll be sure to summarize them and pin your responses in the video comments. Myth number 2, keto causes dangerous ketoacidosis. Ketoacidosis and nutritional ketosis are fundamentally different. In nutritional ketosis, blood ketones typically range between 0.5 to 3 millimoles per liter, and ketoacidosis ketones can exceed 10 millimoles per liter, accompanied by extremely high blood sugar levels and acidic blood, where the blood pH is usually less than 7.3. And just as a reminder, in people without type 1 diabetes or severe insulin deficiency, Low but adequate insulin levels prevent runaway ketone production. So the highest risk group for ketoacidosis are those with type 1 diabetes and people with type 2 diabetes whose insulin production is starting to diminish. And to be honest, the only time I've seen a patient on keto achieve ketoacidosis is when they were taking medications like the SGLT2 inhibitors like Jardiance. So if you're taking that medicine, you should be more cautious. Here's a little more about nutritional ketosis. It's a tightly regulated physiologic state, not a pathologic one. Let's talk a little bit about the mechanism. On a ketogenic diet, the liver converts fatty acids into ketones, beta-hydroxybutyrate and acetoacetate, which serve as an alternative fuel for brain and muscles. This process is triggered by low insulin and high glucagon levels. Claiming keto causes ketoacidosis is like saying moderate exercises causes heat stroke. One is safe and natural, the other is an extreme pathological condition. Myth number 3, the brain needs carbohydrates to function. This is a persistent myth, but it is not true. And I definitely want my nutrition colleagues to pay attention to this one because periodically I'll hear this from these professionals. Our bodies do not require dietary carbohydrates, or stated another way, exogenous sources of carbohydrates, because the body can produce glucose through gluconeogenesis. I know you remember learning about that in biochemistry, but let me connect the dots. Gluconeogenesis is the process where the liver converts non-carbohydrate substrates like amino acids and glycerol into glucose. So essentially, the amino acid of the protein we eat can be a source of all the glucose we need without actually eating carbohydrates. It helps to explain why your brain has fuel even when you're not eating. And speaking of the brain, when you're in ketosis, ketones can supply up to 70% of the brain's energy needs. Ketones are a more efficient and less inflammatory fuel source than glucose. Ketones are neuroprotective. Ketones reduce oxidative stress and mitochondrial dysfunction in the brain. As a result, they've shown promise in conditions like Alzheimer's dementia, epilepsy, and traumatic brain injuries. So contrary to what you've been told for years, our brains are not addicted to carbs and are very capable of running on the cleaner fuel, ketone. In fact, ketosis has been shown to enhance cognitive performance and reduce mental fatigue. And just as an aside, it's been a game changer for me as a physician personally, and I see this happen for my patients as well. They just can't imagine going back to the way their brain used to work. Myth number 4, keto damages the kidneys. This myth confuses keto with high-protein diets. Keto is a high-fat, moderate protein diet. Let me repeat it. It is not a high-protein diet. Now, it's true that excessive protein intake can stress the kidneys in individuals with pre-existing kidney disease, but keto's balanced protein levels are safe for most people. Studies have shown that low-carb diets can reduce hyperfiltration, a sign of kidney stress, and improve markers of kidney health in people with type 2 diabetes. And what's the mechanism here? Keto lowers blood glucose and insulin levels, reducing the glycation and oxidative stress that damages kidneys over time. Additionally, keto improves blood pressure control, another key factor in preserving kidney health. The real culprit behind kidney damage isn't dietary fat. It's chronically elevated blood sugar and insulin levels, which keto helps to control. Which is why the number one reason why people end up on dialysis is uncontrolled diabetes. Myth number 5, keto increases cancer risk. On the contrary, keto may actually help starve cancer cells. That may be new to some, but many watching this video in the low-carb community have heard this before. Here's the mechanism. Most cancer cells rely heavily on glucose for energy due to a phenomena called the Warburg effect, where cancer cells preferentially use glycolysis even in the presence of oxygen. And this is such an important concept that I suggest you check out a video that I did with Dr. Paul Merrick, where we literally broke down why cancer cells love glucose. I'll be sure to share that video in the comments. And with that knowledge, you'll then appreciate why a diet that lowers glucose can be so beneficial. Ketogenic diets lower glucose and insulin levels, creating a metabolic environment less favorable for cancer cell growth. Normal cells can adapt to ketones, but many cancer cells cannot. Here's the mechanism. Keto reduces insulin-like growth factor IGF-1, a hormone that promotes cell proliferation and tumor growth. It also reduces chronic inflammation, a major driver of cancer. While keto isn't a standalone cure for cancer, it's an exciting adjunct therapy being explored in clinical research. So there you have it, the 5 top myths about the keto diet tailored to my clinical colleagues. But before we close, here are a few more myths worth busting. Some believe keto is just for weight loss, but in reality, it's a metabolic powerhouse for conditions like epilepsy, polycystic ovarian syndrome, and even migraines. The reality, guys, a lot of these are just outdated myths that we need to rethink. So let's change that. Doctors, as clinicians, we have a responsibility to base our recommendations on evidence, not misconceptions. So share this video with at least one colleague. And if that one colleague has 2,500 patients, that's 2,500 lives impacted. Together, let's change outdated thinking and empower patients to take control of their health. Let's lead the charge for a healthier future. And if you made it to the end of this video, I want to thank you for having an open mind, and I hope that I provided some insights that will allow you to question conventional thinking. Thanks for coming to my channel, and I'll see you in the next video.